Hey guys, this is Dr. Dan here coming at you with a Whiteboard Wednesday. On today's Whiteboard Wednesday, we're going to be talking about the old adage of using rice to take care of an injury and instead moving to something that I think is really funny, but I call it meth. Or if you're looking for an easier way, you might even call it match. But what we're talking about when we have this old idea of rice, we're going to say rice used to be the whole rest, immobilize, then you use some ice. You're probably going to compress whatever area got injured, and then you're going to elevate it. Now, what we're finding in some of the literature is that if we just ice things and if we immobilize it, it's not as good as if we add some movement and add some activity to it. So when we go over to our meth analogy, we're going to say M is for move. This might even be mobilize. So mobilize the tissue, mobilize something that's tight. Maybe you rolled an ankle recently, right? And your ankle's really swollen, it gets really stiff. We don't want to just rest an ankle. We want to start to move it and mobilize the joints that are going to be swollen with full of the fluid that your body's using to protect the area. And we want to start to move it with some muscle contraction. You can then also elevate it, right? Elevating is not bad, but it's not the best thing that we can do for an injured joint. So we're still going to elevate. That's totally fine. For T, we're going to say this is for tension. You might even say traction on the joint. So tension and traction, two different ways to look at a joint. If I'm pulling on something, I want to be able to create some more space within the joints and the connective tissues. So that's where traction comes in handy. But tension also, if I'm creating muscle stiffness or joint stiffness around the area, now I'm going to be able to push out some of that fluid if I'm creating some muscle synergies around that joint that was injured. So tension and traction we're going to use here. The H, we're going to say this is something for heat. So instead of cooling something down, we might use heat to warm up that area. Especially if the injury's been going on for a while. Let's say this is now 2 weeks out from, let's use our example of a rolled ankle. If you're 2 weeks out and you still have a bunch of swelling, maybe you got to try some heat to push some of that swelling out of there. What we find is that when you have an injury, there's this process where the body wants to put a whole bunch of fluid or plasma that leaks into the area from the capillaries and the blood vessels, right? So you've got all of this swelling that's built up around that joint that's injured. And what we know about swelling, if it sits in a certain area, is that it increases pain, it increases nerve sensitivities, and it decreases your muscle strength. And we call this force. So if swelling sits in an area for a long time, we're gonna have all of these things, as well as maybe the joint's not gonna move as well, and the body starts to learn different compensation patterns. So that's why we wanna get swelling out of this area. But if I use ice, what I'm going to do is stop this healing cascade from happening even faster. So ice can come in here and it kind of breaks this process of healing because it slows it down, right? So ice is a good thing initially. Let's say the day of, you rolled your ankle. We want to slow down some of that swelling from compressing other things or making that swelling go out of control. But if we do it for prolonged periods, that can limit the amount of time that we have to heal faster. So ice is kind of short-circuiting this process of healing an injury. What we really want to do is get muscle contraction to happen, because that's going to decrease sensitivity of nerves, right? Now we're also going to increase our strength of the muscles around the area, because now you're getting those muscles and that tension to happen, and the body's starting to feel more stable. So overall, we want to move toward a muscle contraction state instead of a muscle resting state. Another way we can think about this, Kelly Starrett said this beautifully, in this whole equation of maybe moving away from ice and into something more active, is we want to get swelling, which is the garbage. We want to get some of that garbage out. So let's say swelling, trash out. So all of the macrophages, all the other cells that are going to come in and start to heal that area and break away some of the dead tissue, With a muscle contraction, we can get trash out, but we also want to get in this area, this joint, right? I want to get groceries in. And groceries are all that fun stuff that we have that's carried into the blood. So let's say our fresh blood supply has all sorts of nutrients, all sorts of sugars and good healing aspects that we want to get into that area to start to heal that injury. So we're trying to move away from something that's more passive to something that's more active in this rice versus meth model. Now, when we fill out some of the match, a couple things we can think about here. We're still going to say move. I'm going to say activate as well. So move and activate. T, we use tension, traction. We can also use compression. So compression is a really good tool because we want to create some tightness around the area so that the swelling has a direction on where it's not supposed to go. So you can compress an area and fluid will move in the opposite direction based on some of these pressure changes. We're also going to use heat for this as well. So some of the big things we want to think about is moving away from a more passive plan of care to something that's more of an active plan of care. And overall, some of the things we're thinking about as well was moving away from ice and using something more like heat to start to help a patient or some of your athletes feel better with a joint that's injured or with an area of the body that's being in a prolonged injury state for a while, because we don't want swelling to sit in that area and we don't want some of these pain sensitivity things to be happening for a prolonged period of time. Hopefully, some of this stuff helps and it gives you a framework to start to look at when I should use ice and when I should use heat. And maybe if it's not something very acute, like it happened yesterday or today, I want to stay away from ice and maybe use some more of a heat. All right, guys, Dr. Dan signing off. This is Whiteboard Wednesday. Hope you have a great rest of your week.